Children in parts of northern Uganda are dealing with a strange and extremely debilitating disease. Researchers on the ground have yet to pinpoint an origin, which is leaving the cure unknown. Alex Pena reports from Nairobi.
It is called the nodding disease for the effect of nodding back and forth it gives to the affected people. It is mostly children who contract the disease, some as young as 5. It causes epilepsy, seizures, and in some cases, blindness. The Ministry of Health in Uganda says there are now more than 3,000 cases of nodding disease affecting Ugandan children. Rukia Nakamate, a spokesperson for the Ministry of Health, has been on the ground in the affected northern areas. She describes how rampant and serious the disease has become.
Most of them nod, and most of them, because they have epilepsy and they keep falling, you realize that most of them have injuries. Some of their injuries are on their legs, some of them on their hands. It's really a terrible situation, but we are controlling it.
Since 2009, when the first case of nodding disease was recorded in Uganda, there have been 170 documented deaths. The government has been criticized for a slow response to treating what has become a disease quickly growing in numbers. According to Nakamate, some families can have multiple children affected.
You might find that one family is affected and it has about 4 cases. Another family, then, another family that is close by does not have any case, and another family that is a distance apart has 1 case of you. So they are scared, but they also know that this is something that is not contagious, but it's something that whose cause we have also failed to know.
Researchers are still uncertain about the origins of the disease, but there are a few leads. Some believe the black fly-borne parasite, which causes river blindness, may have a link. They've also noticed a deficiency in vitamin B6 in the affected areas. Dr. Joaquim Soweka, a representative for the World Health Organization in Uganda, says the teams are working simultaneously to both pinpoint the cause and treat the symptoms.
It is important early diagnosis, so good surveillance system so that the cases are detected in time before they evolve to more complicated epilepsy-like forms. Usually they respond very well to the medicine we use for epilepsy.
With these epilepsy-like symptoms, Saweka says children with the nodding disease are extremely prone to accidents. Most of the deaths related to the disease have been from secondary causes.
When the seizure affects the child, there is even loss of consciousness. And then what happens if it is near the water, like a river or near the fire? So it can cause the lesion that can lead to the death of the child, you see. And even if the seizures are too strong, so also can end up by the death of the child.
And until doctors and researchers find a cure, treating the symptoms of this unknown and debilitating disease will be first priority. Alex Pena for VOA News, Nairobi.